one side effect often of breast cancer surgery, post-op surgery, or radiated tissue, etc., can be that you get lymphedema.
Hi, if you're here right now, you most likely have a pelvic floor disorder and you're looking for help to figure out what you need to do in order to take care of this problem. That's why we developed Pelvic Floor Pro. Please take the quiz, and in the quiz, it will help you know which exercise plan is for you. These exercise plans have been developed specifically with your symptomology in mind. Follow the link below and get your free trial started today. Your pelvic health is important to us.
Remember, lymphedema and venous issues, they go hand in hand. So if a system is overloaded with too much fluid, which happens, right? Ankyloplastic surgery, reconstruction, I put expanders in, the whole 9 yards. I have extra fluid that's weighing down a system, right? And the system doesn't stay efficient because it can't put up with a load. So think of it, every day you and I make fluid. We always make fluid in, and it should match fluid out. When I have an intervention such as surgery or radiated tissue, and I'm disrupting the flow pattern of the lymph system, then what happens is a lot of times I get this extra protein-rich fluid, and then what will it do? It will accumulate in areas or regions or pockets in the system. And so my visual inspection is going to be really important because that's going to tell me, hey, where might there be extra fluid? But I want you to know first where the main nodes live. And once you know where those main large nodes are, it helps us long-term know how we'll move fluid around an area where nodes might have been removed, right? Because when we have cancer and the side effects of radiation or surgical incision lines, etc., we might have drains that are affected adversely because we have a scar line there or we've had radiated tissue. And so we always have to think through, where are we going to divert that lymphatic flow pattern? So let's talk about a normal lymph system first. Our normal big terminus nodes, they live what? Right subclavicularly. So if you kind of feel up here where your clavicle bones are, this is the subclavicular region right in here, right? So these are my main big terminus nodes. They do what? They pull all the fluid towards them. And who helps with this is our deep breathing. We talked about that earlier. Remember, with deep breathing, you're using ribs and breathing all the way down into the abdominal pelvic region, right? And that really activates the big cisterna-chyli pump that's there. So you know that breath work helps, but these big terminus nodes are super important because if they're overloaded, guess what? That they can't pull fluid from other places. When we're looking at breast cancer particularly, we're always looking at the main terminus nodes, right? Because look at how close they are also. So main terminus nodes. But then I have a really nice, what's called the mascony. It's another line of nodes that sits right in here. And it's a help feeder system to kind of help all this kind of flow up. Think of it, the whole breast region, all 4 quadrants drain into the axilla region and then have to come up and follow to go through mascony and then into terminus nodes. So huge set of nodes under the armpit. In the arm itself, we have a large set of nodes that's right at the elbow. So this happens to be a main drain section right here. So if suddenly I have a backlog of fluid into my arm into here, something then we know is bottlenecked in the elbow here or up higher, because fluid accumulates downstream of where the bottleneck actually is, always. My other main nodes, as we mentioned, is cisterna-chyli here, so our breath pattern works beautiful. I love all kinds of range of motion exercises, for the trunk, because the more mobile my trunk is, the more I help pump fluid. Why do we care about that with breast cancer patients? Because they get so stiff in the upper girdle. And remember, the lower girdle and the upper girdle, they talk to each other all day long. So if I can't move my upper girdle yet, just as I showed you before, maybe I have to move my girdle below, because the girdle below can then help activate the pump to pull fluid. Otherwise, I can get fluid sitting in this whole abdominal region and then all the way into my back, into this region. And you and I don't want fluid thinking, oh, that's the new route that it's allowed to live in. No, lymphatic fluid should always do what? Fluid in, match fluid out every day, and never have a hyperaccumulation of fluid in a region, right? So when we see extra fluid, and that's why we always look and we compare. If you're bilateral, that's harder, but we look to compare to see, hey, where do I see fluid maybe sitting, right? My next big set of nodes beside my abdominal area, which was that cisterna chyli, is going to be in the growing area here, okay? So my leg motions become super important as well, because I want to keep everything activated. My next set of big nodes lies right behind my knees on both sides. So nice knee motions and hip motions together. They just help keep activating the system, like pull in of my trunk, right? I need to keep all of my lymphatics working well post-op breast cancer. It's super important. So again, let's just review quick. Main nodes, terminus nodes, right? I have a line of Mascony. It's sort of a whole chain that comes through here. I have my big axillary nodes. I have nodes in both of my elbows. I have a huge node that's very deep that sits here. I have growing nodes as well. I can swipe growing nodes, or I can pull up through this. There's a whole abdominal drain I'll teach you on another video clip, but I just want you to know where these main nodes are. They will help keep the efficiency of this fluid moving in and moving out every day. Remember, it's protein-rich fluid. It's very thick and dense. Sometimes people describe it like gelatin. Some it's sticky and tacky. It loves to have fatty adipose tissue cling to it, and that's why if we leave lymphatic fluid, because sometimes people say, well, why am I even worried about this extra fluid? Because if you leave it in an area, guess what it loves to do? It likes to collect adipose tissue to it. So suddenly we'll get a thicker, denser area in a whole region, and then it begins to change the way the skin looks and the texture of the skin. So knowing then where all these main nodes lie, it helps us know how we're going to actually maybe divert lymph fluid around an area, maybe where I have scar tissue. Some of you who have had axillary dissections, you might have an area where they've had to cut through tissue through here to get into the axilla. You might have a scar line in the axilla, and remember, fluid loves to collect below a scar line. So if I've had a lady who maybe had oncoplastic work done, and they've had, a scar line here maybe, or a scar line here and under, they may collect fluid behind the scar line because it doesn't know how to get through the scar line. Because remember, as we talked about before, you have epidermis layer of the skin, dermal layer of the skin, right? And my lymph system is right here. It's underneath the layers of the skin, and the muscle is here. So when I activate the muscle, what am I doing? I'm going to help pump the lymph system so I can get rid of all this extra fluid that might be inhibiting my good, healthy scar line, to repair itself, or other tissue from healing as well. So we want this edema to move out of the area.